one of the diseases that is top 10, I would say. Top 10 killer diseases in Africa. And it's one that is very undermined by you and me today. And that disease is caused by just a simple fly that we really undermine, but it's very deadly. That disease is malaria. As we all know, maybe just to inform you that Kavango, like in the location we are today, the location we find ourselves here, Ruben, malaria is the highest here. It's very high compared to other parts of Namibia, of course with Katima. We are talking of places like these that are close to the rivers. We call them endemic places. So malaria, just to inform you, is one of the top 10 killer diseases in Africa. If you go on your Google search and you search top 10 killer diseases in Africa, you'll find it there. Whatever source you're going to use, whether it's Google or you ask ChatGPT, it's placed top 10. It's one of the top 10 killer diseases. So I would start by asking what malaria is. Okay, malaria is just a disease that is caused by a mosquito. They say it's an infected female mosquito. And we really undermine this disease called malaria. Maybe I just want to confirm, amongst us who are sitting here today, I want to see by the raise of your hand, who has slept under a mosquito net last night? Raise your hand. A treated mosquito net. If you are saying treated, it means 6 months. If you have been sleeping under it more than 6 months and it has not been treated, I think you are at risk, I would say. So I saw one hand. Last night, who slept under a treated mosquito net? Okay, under a mosquito net. I saw your hand. Okay, I just saw one hand. We are at risk. So it means we are undermining this disease called malaria. So what is the cause? Maybe my objectives today is what is malaria? That's one. Number two, what causes malaria? Number three, what are the symptoms maybe? What are you supposed to look out for you to go and be tested? Number four is, can we prevent it? Is it preventable? And the last but not the least is, can it be treated? Can malaria be treated? So we have already discovered what malaria is. And we said malaria is a disease that is caused by an infected female mosquito. When that mosquito bites you, it transmits a disease in you. It's symptoms that will grow in you. It is a time frame where you start developing some symptoms. So that is malaria. And I said we are at risk in Ruben where we are. If I were to tell you, last week we were placed in a clinic and every day they are testing positive. Patients, maybe 3 or 4 patients are testing positive to malaria. So you and me are at risk if majority of us have not slept under a treated mosquito net. Of course, it's not the only prevention. We'll hear more when we go to that part. So the cause, I've already told you that it's a female. Not only a female, but an infected female mosquito that can transmit this disease to you and me. That is for the top 10 of the killer diseases in Africa. There's an infected female mosquito. And my third objective was the symptoms of malaria. Um, One of the early symptoms of malaria is fever. When you start having fever, you know you have not slept or you have not prevented yourself in any way, and mosquitoes have been biting you in the night. And when you start having fever, when you start having chills, you feel hot, you feel cold sometimes. This also comes with shivering. It's like it's winter, but it's not. You start shivering. Some people have headaches, body tiredness. You feel tired, like we call it fatigue. And one of the symptoms is nausea. You feel like vomiting, but you're not vomiting. Vomiting also is one of the symptoms. Diarrhea is one of the symptoms. As the disease grows in your body, it goes to organs such as the liver and other organs that causes these other symptoms. And if you don't go to a hospital or clinic to be treated early, you can develop what we call complications of malaria. It grows to a certain extent that it can even go to your brain and cause confusion. You start convulsing, and it can deteriorate your respiratory system, and other systems follow as well. So those are some of the symptoms of malaria. So my fourth objective is, can we really prevent this disease called malaria? And the answer to that is yes. One of the prevention measures you and me can use is buying a mosquito net. It's not very expensive. We buy expensive stuff, but a mosquito net is not, it's even under $100. I'm not sure what the price is. So you need to every night, you need to sleep under a treated mosquito net. That is one of the prevention measures. One of them is in the evening when the sun sets, you need to close your windows early so that mosquitoes cannot go in and bite you in the night. And one of the prevention measures is you need to wear long sleeves shirts, so that mosquitoes with legs on you cannot bite. Even when it bites, it cannot get your skin. Actually transmit the disease to you. One of the prevention measures is when you look at the surroundings where you live, your home. If there are any standing waters around there, whether it's there are holes there that are filled with water, or maybe in the tires or in the cans around there, we need to make sure that there is no standing water. And we need to clean our surroundings, the grasses around our houses or our environments, because those are the breeding areas of mosquitoes that would, later in the night, if you don't clear those things, you are creating an environment where these mosquitoes will breed and come in your house in the night and bite you. One of the things, maybe not recommended for those who are asthmatic, coils. You burn it. Of course, you need to go out and leave it to burn so that the mosquitoes can be killed that are inside. And the last one, there might be many, but the last one is there are dooms that are used. You buy dooms for mosquitoes just to spray in them, to kill mosquitoes. And the Minister of Health, Namibian Minister of Health, used to do indoor residual spraying during, when you see it's November, December, somewhere there, when it starts to rain. But most of us, we informed that we refuse these people to come in and spray in our houses, actually prevent mosquitoes to come in. But it's very important because it's one of the prevention measures, mosquitoes not to bite us to cause malaria. And the last one, my objective is treatment. Once you find out that you have the symptoms that I have said, and more that you can find out on your own, you go to the facility, of course, the clinic or the hospital. Then they will screen you for malaria. Once they find out that you have malaria, the good news is that they can treat you. There is treatment. They can give you tablets. If it's severe, they can admit you and you get treated and you get back to normal life. So we need to be aware and do the right things to be prevented from this top 10 killer disease in Africa. This is the health talk of today. Thank you.